A ventilator is a life-supporting medical device that helps patients breathe when they are unable to do so on their own or when their breathing is weak. This machine delivers oxygen into the lungs and removes carbon dioxide from the body. Ventilators are commonly used in intensive care unit, which is ICU, operating rooms, and emergency situations. They are especially important for patients with several respiratory problems such as pneumonia, lung failure, chest trauma, or infection like COVID-19. The main purpose of a ventilator are to ensure that the body receives enough oxygen to reduce the breathing effort of the patient, to stabilize breathing during critical conditions or after major surgery, to give the lungs time to rest and heal.
A ventilator has several important functions. First, it can take over the patient breathing completely by pushing oxygen into the lungs at a specific pressure and rate. Second, it can also support patients who can still breathing and a little bit on their own. Third, the ventilator has a monitoring features that check the breathing rate, air pressure, and oxygen level, and it will give an alarm if there are any problems. Lastly, the setting on the ventilator can be adjusted based on the patient needs. Next, let's talk about the advantage. One of the biggest advantage is the ventilator save life in situations where patients cannot breathe on their own. They provide stable and controlled breathing support, which can make it easier for doctor and nurse to give other treatment. Ventilator also helps the lungs to rest and recover. However, there are also some disadvantages. Long-term use of ventilator can cause lung infection such as ventilator-associated pneumonia. It may also cause the discomfort or injury to the airway. If used for too long, patient can become dependent on the machine. Besides that, the ventilator also quite expensive to maintain. So, while ventilators are very helpful, they must be used carefully and also under close the medical supervision.
Lastly, I will explain about the cost of ventilator and where they are usually used. The price of a ventilator depends on the model and its features. Generally, a ventilator can cost from around Rm3,000 to 150,000 or more. Portable ventilators, which are used in ambulance or emergency situations, are cheaper, but advanced ICU ventilators are more expensive because they have more monitoring and control features. Ventilators are commonly used in intensive care unit for critical patients, in operating room during surgery, and in ambulance during emergency. They can also be used for home care for patients with long-term breathing problems and in field hospital during disaster or military operation. In conclusion, the ventilator is a very important therapeutic medical device. It helps patients breathe, support their recovery, and save life. However, it also requires proper care, trained staff, and can be quite costly. Thank you for listening to our presentation.